All right. Good morning, everyone. I'm going to go ahead and get started. I want to welcome everyone to our 8th session of the 2020 CCDEH Virtual Training Series. For those of you who don't know me, my name is April Meneghetti, and I'm the Director of Environmental Health in Yolo County, and I'm the President of CCDEH. I want to start off by giving a big thank you to our sponsors. Acela, who's our sponsor for our training series and is providing us this awesome Zoom support, which we very much appreciate. Also, I want to say a thank you to Hedro for sponsoring 3 rural county scholarships. And also a thank you to KHA for the sponsoring of 20 retired director scholarships. I want to remind everybody that there's still plenty of time to get in your excellence in environmental health nominations. They're due on September 30th, which is next week. So I encourage you, if you haven't already done so, to get something in. We have 2 awards this year. One is COVID related and one's non-COVID related. Also, I just want to, Jeff will talk about this more in a minute, but I just want to remind everybody that you can look at our previous presentations if you go to the video library, which Tim just was showing us how to do. And there you can see all of our previous virtual trainings that we've done. If you haven't already watched some of these, I highly encourage you to do so. And then I also want to I hope that you guys will be able to join us for more of our upcoming sessions. These will continue through November 5th. And then next week on Thursday, we're going to be having our annual meeting. So I hope that you'll be able to join us for that as well. Next, I want to go ahead and introduce Jeff Lamore, who's our CCDEH President-elect. Here you go. Thank you. Have a good day.
Thank you, April. Good morning, everyone. Welcome to CCDEH's virtual training series. The live training series is open to all CCDEH members, including associate members. In order to receive your CEUs for each training session, you'll need to complete the course evaluation. Tim's pulling that up as we speak. Located towards the middle of the virtual training series webpage. Click on the RHS course tab, evaluation tab, click next, and click on and complete the requested information. For CCDEH members, one certificate will be issued at the conclusion of the training series. Only those sessions you have attended and have completed a course evaluation will be listed on your certificate, so please keep that in mind. For all other RHS, you can log on to CCDEH's website to access the training series. Once you've completed the training series, return to the virtual training series webpage to complete the course evaluation and obtain your CEU certificate. Just as a reminder, the video series are located under the events tab as April indicated. The training videos will be posted within a week or so after each live session. Again, non-registered members can go to the events tab to access the videos in the video library. Please remember to use the Q&A function when asking questions. That's very important. Please go to the Q&A functions to do that. And for those that are wanting to review the 2020 member directory, you can also locate that on the just underneath the evaluation tab, course evaluation tab. And with that, I will turn it over to Ron Browder, Director of Alameda County Environmental Health. I'll turn it over to you, Ron.
Thanks, Jeff, and good morning, everyone. As the training manager for the California Connected COVID-19 Virtual Training Academy, Hannah Malan manages the implementation of virtual training courses for California's COVID-19 contact tracing workforce. In addition to managing over 30 training facilitators, Hannah collaborates with subject matter experts to design, deliver, and continually enhance virtual training. Hannah received both a PhD and Master's of Science in Public Health from the UCLA Fielding School of Public Health. Her research interests include community-driven approaches to promoting health and environmental sustainability. It's my pleasure to present to you Hannah Malan.
Good morning. Thank you. And thank you for my speaker gift. This is really one of the most comfortable masks I've worn. So thank you, Ron, and thank you so much for having me. It's really a pleasure to be here. I guess what my bio didn't say is that I'm a recent grad. I'm a 2020 PhD, and it's pretty shocking, and really an honor also to be coming into the public health workforce and joining all of you during this really crazy time. So thanks for having me, and I'm delighted to be here to share with you some of what we're doing with the intention of connecting some of the lessons we've learned, some of the things we're thinking about and working on, and hoping that can help inform your work, since we're really partners in this. So the title of my presentation is Using COVID-19 Contact Tracing as a Tool for EH Management and Program Implementation. But what I'm really going to do is start by talking about what we're doing. I know you've all heard about contact tracing going on. Many of you, as Ron mentioned, know folks, even your colleagues, who have been redeployed to be contact tracers. We know there are over 7,000 folks from local health jurisdictions working as contact tracers. And so I want to talk about that a little bit. Then I want to go into the pillars of containment. And we'll talk about, so I'll go through my educational objectives here with you. So first I'll discuss California's approach to implementing contact tracing. We'll discuss the 4 pillars of containment, and those can really be applied not just to COVID-19, but I want you to start thinking about what that means for other types of outbreaks as well. I'll describe the purpose of isolation and quarantine, and that's really what we're doing as contact tracers and case investigators, is partnering with the public to figure out how to support people in isolation and quarantine. Understanding the role of support services in containment. So rather than just telling people what to do, thinking about how we support them in doing that. And Ron really recommended that I talk about our strategies for helping our workforce overcome challenging situations such as mistrust and cultural barriers. And then I want to end with kind of discussing some key takeaways about how our training format and principles can be applied for management and program implementation in all of your work. So let's start at the beginning. So I want to start by just introducing California's contact tracing program, which is called California Connected, and it's really a partnership of the California Department of Public Health, the Training Prevention Center, UCSF's Pandemic Initiative for Equity and Action, UCLA, so I'm actually employed by the Fielding School of Public Health, but then work on part of this project, and then all the local health departments. So it's all of these folks working together to build up our workforce, to train our workforce, and to implement this really vast and ever-changing program. So what's happening in California? What's going on right now? What even is contact tracing? We're hearing a lot about it more and more, especially in this second phase that we're coming into now. And I want to kind of position contact tracing as essential, like your work, to safely reopening California. And I know this is what you're all working on too, is figuring out how do we open California, get back to doing the things we love to do, supporting our businesses, enjoying our lives, seeing people. How do we do this in a safe way, in a way that supports our economy, supports all the things that make us Californians and enjoy our beautiful state, getting out to the parks, right? Restaurants, all of those things. And how do we do it safely? So in that way, I really feel like we work hand in hand, and I'll talk a little bit more about how what we're doing can support your work as well. But first, let's just do a little background. I love this video, and I think it does a really nice job to just remind us what is contact tracing.
Hey, you.
So can you all hear my sound? Can Tim or someone give me a thumbs up?
Yes, we're hearing it.
Great.
You've practiced physical distancing, washed your hands, worn a face covering, and stayed home. Maybe even taught school from your kitchen table. We've slowed the spread of COVID-19, so now we can move to the next step in our plan to defeat it. Contact tracing. It's not new. We've used it for years to fight infectious diseases like tuberculosis and measles. Here's how it works. The California COVID team, made up of members of your local health department, will call you if you or someone you've been in close contact with has tested positive. The first step is to answer the call and answer some questions. Your information is kept confidential and protected by California's strict privacy laws. The goal is to prevent more people from getting sick and help those who test positive for COVID get care and resources. So please do your part. The more people answer the call, the more we keep our families and communities healthy. Answer the call, slow the spread. Hey, you.
Great. Okay, so that's a little background on contact tracing. And one thing I wanted to remind you all is that contact tracing is not new. This didn't just emerge for COVID-19. A lot of the folks I work with from CDPH and also from UCSF and others have been working in the tuberculosis branch and are experts in contact tracing for other diseases. So this is really a proven public health intervention that we are now adapting to address the need of our community, and as we continue to learn more about COVID-19, using scientific evidence and benchmarks to inform how we design our program. So in May, I think it was the 22nd, Governor Newsom announced this goal of training and really ramping up this workforce of 10,000 contact tracers and case investigators. I just received a notice this morning that we have met that goal, which is amazing. Over 2,000 over 2/3 of these folks are coming from local health jurisdictions, so either already working or have been identified and are being trained to be contact tracers and case investigators, and also over 3,000 redeployed state staff. So I think you may have heard it can be anyone from librarians, Department of Transportation, all sorts of different state departments who have been reassigned to go and support the local health departments in doing this work. So right now we've got 3,000 who are over 3,000 who are identified, and 1,700 who are currently deployed or working in 27 local health departments. So you can see here the counties which are highlighted where we already have state staff working. So the plan was, just so you all know what's going on with this, the plan was for the state to provide staff to serve as contact tracers, because we really wanted to have this broad network. Then what happened is cases surged, and contact tracing only works if we have enough case investigators to identify the index case and elicit the contacts. So we figured out we needed more case investigators. So then the state came back and we're saying, okay, we need to train more people to be case investigators. And I'll talk a little bit more about what that means. So now we're adjusting, and I just want to point this out because plans change, and we are really trying to be adaptive to local needs, and our training program is adapting to meet those needs as well. So that's where I come in. So thanks for the introduction, Ron. So I am a training manager at California's COVID-19 Virtual Training Academy, and I manage our team of facilitators who lead our skills-based development part of our training. So our training involves both live webinars, something like this, where we have subject matter experts deliver lectures essentially in the mornings. But then one of the areas where we receive the most positive feedback, and we do evaluations of our work, is really in the small group skills development labs, we call them. So we have groups of 200 who come into a Zoom session. We break everybody out into breakout rooms with about 5 to 6 people and a facilitator. And then we start practicing. We throw in challenging scenarios. We give them the script to practice. We really get into the reality of what this is going to be like, right? Because we know from adult learning theory that adults really learn best when there's interaction. So I have to apologize that I'm not doing too much of that this morning, even though we know that's the best way for folks to learn. And while it can be uncomfortable to learn in a small group setting and people can be put on the spot, we're really figuring out how to make the spaces feel comfortable for folks. Tech support is a huge part of it, and we're lucky to have a great tech support team here today, but helping folks not only get onboarded into this new role that many of them actually just been reassigned to do, but then also navigating the technical challenges of learning to do all of this on Zoom. So I'd be happy to talk more about that at the end if you're interested in the logistics of how we do that. So we've got this excellent training team. It's funny, I work with these folks every single day. I think there are only 3 people on this slide who I've ever met in person. But we really have created a robust training team. And yeah, my whole experience with this team so far has been virtual. So it's really interesting how we've been able to adapt to the current need. So what do we do? So we describe our training as a rapid, effective training and skills development where we introduce learners to public health basics of epidemiology as they relate to COVID-19. We help learners understand case investigation and contact tracing activities. And then a big part is building interviewing skills. And I'll talk more about that too. We teach learners the essential components of isolation and quarantine, and I'll actually go through that with you all today. And this last piece is really crucial, which is ensuring that learners can conduct all activities in alignment with principles of good public health practice. And today I'm going to really focus on, it says cultural sensitivity here, but I like to refer to it as cultural humility. And we'll talk about that approach and how this is really our strategy for building trust with the community, for increasing the likelihood of compliance, because we actually can't enforce our recommendations of quarantine and isolation right now. Although there is precedent for us to be able to enforce, that's not something we're doing. So we are really relying on the skills of our interviewers, our contact tracers and case investigators, to build rapport and build trust with our contacts to follow these public health recommendations. So far in our training academy, we've trained over 7,000 learners, and you'll notice that number doesn't match up with the 10,000 I previously mentioned. So some big counties like LA and San Diego, who I love, they run their own training programs because they have such a large number of folks doing this work. So we're really there to train anyone who wants to come through our training program. So we have majority of folks coming from smaller local health jurisdictions and then state employees as well. So on average, we do about 400 learners a week that we're training. So this is a lot. I don't want to spend too much time on this, but I just wanted you to get a sense of what our 4-day training feels like. Sorry, I've got a little pup in the background who's making some noise, but our current courses are contact tracing, case investigation, and then our new, as I mentioned, adapted course is case investigation for folks who have already been trained to be contact tracers, but we just need more case investigators. So we're identifying folks who are excelling in their role as contact tracers, bringing them back and training them as case investigators. So as I mentioned, this includes live webinars, and then we do skills labs where we really develop the skills needed to conduct this work. So that's like the soft skills. So our role is more than just epidemiology. It's really being almost like social workers in a lot of way too, and meeting the community where they are and providing the wraparound services or social services folks need to successfully isolate and quarantine. So we've got a 4-day training that includes epidemiology, as I mentioned, but also all of this content about cultural humility, interviewing skills, and then folks do get trained on the digital application they use, which is called CalConnect. Okay, so now I want to get into some of the substantive or more academic part of this, and I'll go into pillars of containment, discuss isolation and quarantine, and then talk a little bit about support services. So this is material we actually present in our training academy. So I want to start with this pillars of containment and thinking about what does it mean to box it in, to contain this thing in a way to get us all working again, or as I mentioned, to get us all safely back out into California doing the things we love. So the first is to test widely. And I'll talk a little bit about not just widespread testing, but appropriate turnaround times for testing and why that's so important. We then need people who are infected to isolate. We also then, and this is what our case investigators do, is once we identify cases, so people who have confirmed coronavirus case, and this is a reportable disease to the Department of Public Health, we reach out to those folks. Sometimes we're delivering the news that their case is positive, so our case investigators are also trained in delivering news and talking with people about what that means. Another part of their job is eliciting contacts, so building trust enough to say to a case, who have you been in close contact with? And we measure this as 48 hours prior to their illness onset. So that means either a positive test or their symptoms started. So isolating people who are sick, finding everyone who has been in contact with infected people, and then asking people who have been in contact to quarantine. And quarantine is asking folks to stay home, to be home except for essential medical visits for 14 days. And this 14-day recommendation is a science-based recommendation based on the incubation period, right? So how long it can take for illness onset. So we know that most people get sick within 4 to 5 days, but it can take, the range here is 2 to 14 days for illness onset for COVID-19. The other part that I'm sure you've heard about in the news is that COVID is especially challenging because of our asymptomatic cases. So estimates are 40 to 45% of cases can be asymptomatic, which means folks can be, moving around, going into restaurants or other places, not knowing they have the disease and potentially infecting others. So contact tracing and case investigation alone are not enough. We need these things to happen in order to do our job successfully. And I'll go through them. The first is getting tested if indicated. The second, as I mentioned, is this quarantine and isolation, and then accessing social services. So testing. So this little cartoon here, this is annotated by one of our epidemiologist friends. And on the left, we see, let's call her Sally, on Monday, gets a COVID test. She's feeling fine, so she continues her life, goes around, she goes to the market, goes to lunch, blah, blah, blah. She gets her test on Sunday, it's negative. Yay, great, keep living, Sally. However, we see another scenario on the right where Sally gets tested. She's still feeling fine, so she goes to the market, she does her things. Each interaction she has, she's exposing another person. Then she gets her positive test on Sunday. Uh-oh, everyone she's been in contact with is now possibly, has been exposed and could potentially have COVID themselves. And you can see how this can exponentiate, and everyone who's walking around thinking that they're feeling fine is potentially infecting others. So a thing that's not illustrated here is that it's possible that someone could get a negative test and still develop COVID in the next however many, I think this is 7 days. So they still have 7 days left in their incubation period where they could develop the disease. And so these are things that make it really complicated to keep people safe, and why contact tracing and case investigation is so important, which is reaching out to people to let them know they've been exposed so they can stay home and prevent the possible transmission. So if people are out in restaurants or people are out in parks doing things, we want to do the social distancing strategies of wearing a mask, keeping a distance, doing all those things. But it's also really important to keep people who are already exposed out of those situations, so we're reducing the risk to the public. So who is a priority for testing? California is using, so these guidelines are coming from the Department of Public Health, and we're recommending that all symptomatic persons get tested. We also recommend that close contacts get tested when feasible. So we would recommend, if possible, everyone who's a close contact get tested. However, Accessibility may vary by local health jurisdiction, so we do advise our contact tracers to review their local guidelines before providing referrals and asking people to test. So this next is isolation and quarantine. I've gone into this in depth quite a bit, but I do want to distinguish for you all how we're defining isolation versus quarantine. So for both of these, the recommendation is that folks stay home. It's not like quarantine, like we all have been saying, oh, we've been quarantining for 4 months or whatever. No, we haven't. We've been social distancing, right? The stay-at-home order was more like a quarantine, which was folks stay at home except for essential medical visits. So with quarantine, we don't even, we ask people not even to go out and buy food, not even to go out and exercise. We're asking people to stay home during that 14-day quarantine period when we know they might have been exposed to someone with COVID-19. So it's really a difference here. And then isolation is for people who we know are infected with the virus. And again, it can be folks who have no symptoms but got a positive test, or those who are experiencing symptoms. But both of these require folks to stay home and stay out of those public settings to prevent the chain of transmission. So what are the recommendations? As I mentioned, our quarantine period is 14 days from the date of last close contact with the case. And again, this 14 days is based on the incubation period. I want to point out, I mentioned this in the testing cartoon, but we recommend to all of our close contacts that a negative test during this period does not reduce the duration for quarantine. So as I mentioned, if Sally got her negative test result on day 7, she still has to quarantine for another 7 days because her incubation period is not over yet. So we're really taking this science-based precautionary principle and saying, stay home for those 14 days because there is still an amount of time that you could become sick. And then if folks do develop symptoms while they're in quarantine, then they should switch to isolation. And isolation, as I mentioned, is for folks who are sick or get a positive test. So for isolation, if folks are symptomatic, we ask them to isolate for 10 days from the date of their symptom onset, and they have no fever for a day without using anti-fever medications, and their symptoms have improved. If they're asymptomatic, we still ask them to isolate for 10 days since the date of their positive test, and they must continue to have no symptoms. So who are close contacts? So this is an essential definition for contact tracing, right? Contacts are our people that we want to keep out of the public to reduce the chain of transmission. So we define a close contact as a person who had close contact with the case, the person with confirmed coronavirus. So this includes all household members and intimate partners, anyone the case may have coughed, sneezed on, or shared utensils with. So if it's a group of friends at a restaurant and they're there, but they maybe share a plate of food in the middle of the table, that's considered a close contact. And then another key definition is within 6 feet for at least 15 minutes. And this 15 minutes is based on cumulative rather than consecutive exposure. So cumulative meaning over the course of a day, did you spend 15 minutes within 6 feet of someone? So this can happen at places like work, large gatherings, visits to congregate settings, or other close contact settings. Okay, so now I want to get into the really, the human side of this. And I would love if, I'm just trying to see if I can see my chat box here, but I would love if you could all share with me in the chat, what are some reasons people might have difficulty with isolation or quarantine, staying home for 10 days or 14 days? I'm just going to stop my share so I can see the chat. And I would love to see if you can participate. Please just give me some suggestions and go ahead and type in the chat. What are some reasons why it might be difficult for people to stay home for 14 days or 10 days? Lack of stable housing. Thank you, Kendra. Can't earn money, must work. Yeah, I can't take time off work. Exactly. Access to food, Cynthia says. No sick leave. Yes. Kids need help. Kids needs. Yes. Thank you, everyone. So these are really important things. Supporting parents, right? Having other responsibilities that people rely on you and you need to do things. Yeah, appointments, medical, dental, vision. Absolutely. Thank you for sharing these. And I want you all to be thinking about this, and I'll talk about, we do a whole session on respecting context. And that really informs what we do of providing services, recommendations, and action plans for how folks can successfully quarantine and isolate. So for example, some of the questions we ask in our interviews to assess how easy or difficult it might be for someone include, how many people do you live with? Do you have enough food, medications, or other needed supplies for 14 days? How will you prepare your own food? Who can assist you with getting meals? Are you able to isolate yourself at home? In some areas, there's temporary housing available. Are you able to have a bathroom to yourself? If not, are you able to clean the bathroom with disinfectant? Do you need support with activities of daily living? We can also provide letters so that people can give letters to their employers, notifying them that they've been identified as a close contact to help with getting time off of work. And so I want to talk about helping folks access social services, which would include anything from connecting them with food delivery, helping them problem solve, how they might get support with checking on an ailing parent or other needs with kids, and also doing things like finding out how they might sign up for medical insurance, right? Seeing what they're qualified for, or accessing paid sick leave or those types of benefits. So in addition to the contact tracers, they all work on teams that include a social worker, a clinician, and other professionals who can help with this wraparound or support services that folks need to stay home. So here, the types of things, just as you mentioned, are food to eat, right? People need medicines and other essential items, other services, and a location to isolate or quarantine. So thinking through what do those housing situations look like, and what would the reality of this person's quarantine or isolation look like? So again, we problem solve, and what we call is action planning with our contacts, to ask clients if they have family members, neighbors, social or other networks that can help them bring necessary supplies. So we help the person first think about what's possible for them before we get other services involved. And then we think about what's available in their local jurisdiction to help support them. Mental health is also a really important issue in all of this. We know that during the pandemic, mental health issues have really been exacerbated, and people are in tough situations that are only getting harder. So our staff connects folks with services as needed and is trained to identify when those issues might be coming up. So again, it's not just, a big part of this is communication. It's not just saying, here's what you need to do, you need to stay home for 14 days, but it's thinking about how this is really going to happen, how this is going to happen safely, and helping folks understand why it's important for them to isolate or quarantine to stop the spread of COVID-19. So a lot of it is translating academic or epidemiology, that type of language into lay language to connect with our community, to build trust, and to help people understand that we're there to support them. So I want to discuss our approach to overcoming challenging situations such as mistrust and cultural barriers. And our module that really encompasses our strategy is called Respecting the Context, and Cultural Humility Matters. So what does this mean? This means that when we go into a call, when we do our interviews, we're thinking about what's happening on the other end. We're thinking about, who is this person? I know I have my green screen up, or not my green screen, but my background up, but all you can see right now is this. We want our folks to think about everything that's happening behind here. So it can be a really intimate conversation going into somebody's lives. And what are the things that might be on their mind? Mistrust, anxiety, housing, their socioeconomic situation, right? Work, how am I going to get money? That's more important than isolating or quarantining. Immigration status, what are you going to do with my information? Stigma, right? Fear of feeling embarrassed that you were exposed or that you might be putting your family at risk. Other cultural differences, like we now do a skills lab for Spanish speakers because 30% of our interviews are actually done in Spanish. So we have translators who do a number of different languages, but then we also talk about how the skills we use might be different depending on language or culture. The way you ask a question matters, right? So we're thinking about all these things and training our folks to be mindful of the context behind the recommendation. So I want us to think about what makes up a person, right? Their health status, their age, their sexual orientation, immigration status, all of these things come together to create the person. And part of this is helping our folks understand why we're collecting this information too. So we do ask interview questions about gender, ethnicity, and race, about age, about pre-existing conditions. And we emphasize that the reason we ask these questions is to better understand how the virus is affecting different parts of our community and how we can use these data to better inform our response. So we want to know, where should we be opening different testing sites? Is our communication accessible? Do our materials need to be in different languages? Thinking about those types of things that help make sure we're not just delivering a message, but that the message is received. So cultural humility is really this continuous lifelong process where an individual examines their own beliefs, cultural identities, biases, and values, as well as the beliefs and cultures of others. And this can be hard, especially for people who spent a lot of years in school like I did, but being mindful to relinquish the role of the expert in some cases and become the student of the patient. And this does not mean undermining your own expertise, and you all are trained in what you do, I'm trained in what I do, but it's having the humility to say, this person is an expert in their own life. So how can we combine our expertise to create a plan that is really going to support this person? Because at the end of the day, our role is to protect the public's health. And it's hard to think about that on an individual level, but that's what our folks are doing with every single call. So we really want to say, here are the recommendations. These are science-based, but we're also incorporating this piece of expertise from our community members. So again, what does this mean? Like, okay, these are all flowery words and language. We're getting a little theoretical, blah, 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 annoying. But what does this mean in practice? Sometimes it means admitting you don't know. We train our team to say, I don't know, I'll get back to you. We don't want folks giving incorrect information, right? Suspending judgments, the way someone sounds on the phone or doing something, being aware of your biases and how that might affect the information or the care you're delivering. Empathy, and this is practicing empathy rather than feeling it. So really, really understanding why it might be hard for someone to do this and meeting them where they are. Celebrating diversity, checking your assumptions, and also just becoming comfortable with ambiguity. The science is always changing, and I like to think about this with medicine too, where it's like, we call it practicing medicine, right? And we call it the scientific method because we're always discovering and learning. And I think we have to be comfortable with this idea that everything is a calculated risk. And we want to use science to better inform what we do, but also be comfortable with the idea that sometimes things aren't going to be clear cut and there are going to be examples where things don't exactly match up. And we have to be okay. Everything's on a distribution, right? We're going to have some outliers here and there, but we need to trust the science and be comfortable that what we're doing is based on the best evidence we have right now, and that might change also. So I want to just put that out there as like, we are continuing to learn more. In my PhD, I really also focused on nutrition science. That changes a lot as well. But we need to be comfortable with this idea of the evolution of science and using the best information we have right now to inform our actions. Okay, so I'm getting a little bit towards the end of my slide. I'm just gonna hop through this. These are just examples of language that we would use for this type of thing. But I just wanna say these are the guidelines we train folks on for cross-cultural interactions, right? So empathy, curiosity, and respect. And it's really just showing that you are understanding, right? We're reflecting and hearing what folks are telling us. We train folks with those interviewing skills. We're curious about everyone's different reality and how understanding what folks are going through can help inform how we make recommendations. And then respecting that people get information from different sources, and fear can also inform how we act. So we want to be a trusted source for providing accurate information. All right, so finally, what does this mean for you all, right? How can we use this, everything I've presented that's kind of all over the place, but I really want us to think about what does this mean for your work? And so the first here is that even though COVID, the novel coronavirus, is a novel disease, and the science is changing, as I said, as we continue to learn more, we are building on evidence-based public health interventions to do the work, right? Washing your hands is an evidence-based public health intervention. Wearing a mask is an evidence-based public health intervention. Contact tracing is an evidence-based public health intervention. And we are figuring out how to best adapt and train our workforce to implement these interventions during a time of great uncertainty of COVID-19. So I really want to emphasize that we are using proven methods to respond to this pandemic. And it really takes everyone to be on board and involved to carry this out. So we know what to do, it's just a matter of doing it. I also want to just say that we're doing all of this in a virtual format, and I'd love to talk more about how to use virtual training approaches to improve environmental health management and training. So one of the things we're working on now is developing communities of practice for folks who are working in the field, where we do weekly training sessions where we have guest speakers come, we do continuous education, we feature folks from the workforce, we do like a poolside chat where we learn about each other, we keep up on the science of COVID, and so we're creating an ongoing training experience to maintain accountability and interaction among our team. Another is collecting and utilizing data to inform decision making. So part of the contact tracing effort is building the infrastructure to collect the data we need to soon, when our CalConnect database launches, I believe it's launching next week, is to really understand how outbreaks are occurring, what this chain of transmission looks like, and where we can best intervene. So we're getting to that point now, which is really exciting now that we have our folks trained and starting to do the work. I spent quite a bit of time talking on this, but I just want to reinforce that our approach to enabling compliance with our suggestions and recommendations and requests of isolating and quarantining is to respect the context. So understanding that not everyone we talk to has a master's degree or a 4-year degree or is trained in epidemiology or environmental health or public health, and thinking about how we can better design our approach to serve them. The final thing I'll just end with is that we really want to emphasize our public health mission. And yes, we're collecting data. Yes, we are trying to break the chain of transmission, and we're doing all these sorts of things. But at the end of the day, our team is there to serve the public's health and serve the public's well-being. And we're emphasizing that in order to get everyone back to work, in order to get everyone doing the things they love in California, we want to be able to open California safely and keep folks who are infected and exposed home so that everyone can get back up to speed as soon as possible. So thank you for having me speak about all this today. I think I'm towards the end of my time. I actually can't see my timer on my thing, but
you're good there.
Okay, great.
Anna, fantastic job.
Thanks.
Great presentation. Now is the time for people to use the Q&A function to ask some questions. I have a few questions I'll throw out to you while we wait for some other questions. I was noticing my iPhone did an update recently, and I'm wondering, is there some contact tracing going on through my iPhone?
Not unless you opted into it.
Okay.
So yeah, we are not using any of those. So I know Apple and Google has a contact tracing technology that they are introducing, but we are not using any of that yet. So ours is the tried and true public health method of calling people on the phone. So we're not doing any of the Bluetooth, we're not tracking location, we're not doing any of that. We are relying on the public and building enough trust with the public that our cases actually give us the information of their contacts and we reach out to them by phone. So this is all based, so much of all of our input is from the public.
Have you used Zoom at all for any of these interviews, or is it all, you said it's all via phone?
It's all by phone, yep.
Okay. So then you don't have an online interview kind of question and answer process you can go through to accomplish the same goal of an interview? It has to be via phone?
It's all by phone, yeah. We don't do any like surveys that people fill out online yet, but that's a really interesting idea. I think part of this is not just to get information from people, but is about being a warm body on the phone where they can ask questions, right? Like if I can't go to work and I need to go to work, can you help me think through what my options are? And having, like I know for sure, like I love the internet, but I get frustrated when somebody tells me go to this website and figure it out.
Yeah.
So having someone on the phone to problem solve with you, somebody's work scenario is not going to be the same as somebody else's. So we need to talk through what kind of setting are you working in? What services are available for you? Would a letter be appropriate? Can we figure out what sort of public resources exist for you to get a stopgap in your pay, or just thinking about those things on a case-by-case or client-by-client basis.
Good.
So I see Jamie has a question. Can you explain more about the 14-day quarantine versus 10-day isolation? Yeah. Is 14 days for when the person actually becomes ill versus being exposed? So this is a great question, Jamie, and I'm gonna explain it by using two key terms, which are the incubation period versus the infectious period. So the incubation period is a 14-day period during which time someone can become sick, become infected. So sorry, I say sick, but someone could be asymptomatic. So I could be infected but not feel sick. But 14 days meaning I could get exposed, and it could take as long as 14 days for me to become infected. The 10-day period is based on the infectious period, which is the amount of time that we think people who are infected with the virus can spread it to others. So that's how those numbers are based. And then we do a lot of math and exercises with our trainees talking about, okay, if I saw my brother on May 6th, and he got a positive test on May 8th, like those types of things. So we talk through the math of calculating those periods. It helps to do a visual. I think it would be too confusing to talk about it now, but those are the science-based recommendations. So
see the other question we have there?
Can you talk more about the CalConnect database? Yeah, how it will work and will be used by the counties as well. Absolutely. So this is an exciting update. So I just heard from CDPH that the CalConnect dashboard is being built out right now. And so the way the data works is CalReady, and I'm sure you maybe heard about some of the issues with CalReady data, but CalReady is the system where we get information delivered to our case investigators. And so CalReady has data about the cases. So who tests positive? The CalConnect data is going to be all of our contact tracing data about the contacts. And so it's taking us a while to get the CalConnect database up and running because we first had to train, then we had to deploy all of our contact tracers. And now we're getting, I think it's about half of counties are using CalConnect for over 80% of their contacts. So we're ramping up the use of that database. So right now the data just aren't representative of the state. But that dashboard is going to be coming out next week, and then I think it'll be publicly available in the weeks soon after. So you should be able to find a link to that from the website. Sorry, I was just realizing I didn't show my last slide, which has here. This is the website for contact tracing. But also just the covid19.ca.gov. I'm sure you all use it, but there's the excellent Safer Economies web page that goes through what's open in which county when. And over time, we'll integrate the CalConnect data with all of that.
I have a question. I'm not sure if this is more for Dr. Fauci or if you can answer it. But if a person tests positive and they're asymptomatic, they self-isolate for 14 days?
For 10 days.
For 10 days. Mm-hmm. And then what? If you're asymptomatic but positive, then what do? You can go about normal life or what?
Yeah, so our recommendation for asymptomatic folks is 10 days. I'm just going back to this because I think visuals are easier. So if you're asymptomatic, if you do not have symptoms, you have to isolate for 10 days from the date of your positive test. After that, you are free to go back about your life. We do get questions now about reinfection, and this is a really interesting area. As I'm saying, the science is emerging because there have been 3 verifiable cases of reinfection. But we don't have enough data yet to really understand for how long you are protected against the virus after you have it. And so because this is a novel virus, we're still learning about all of that. So we actually can't say to folks, if you've had the virus, you'll never get it again. So that's still an emerging area.
Are you getting a lot of questions about vaccines?
We are, yeah. And actually, the New York Times has a really excellent vaccine tracker webpage that goes through. And one thing I do want to say about vaccine development is in clinical trials, people do experience side effects, but typically clinical trials aren't under as much scrutiny as, like not everyone's watching them the way they are watching these COVID trials. So I think it's something everyone's keeping an eye on, and there are a lot of great resources to be tracking what's happening with vaccine development. So I would encourage you to read about that if you're interested. Yeah.
All righty. Last chance, people, for any questions of Hannah. Ron, did you want to pipe in here at all at the end, or Justin? Give you a moment. Don't see any more questions. Hannah, any final thoughts?
I see one more question about the, did they experience mild symptoms or the same as before? I don't know that, but that's a great question.
Okay. So Hannah, I'm going to give you the last word here as you wrap up.
Oh, okay, great. Well, I think I just want to say that I really appreciate everything you're all doing. And again, just emphasizing this public health mission and thinking through how we can use data, how we can use the information we're hearing from the public, and thinking about how we can all be partners in safely reopening California. And in that way, I think contact tracers are great allies for you all, because we want to keep folks who are exposed out of our public spaces so that they can be safe for others. So thank you for the work you're doing, and it was a lot of fun being here with you, so thanks very much.
All righty, fantastic, Hannah. I'm going to take the screen back, and I want to show a couple of things as we wrap up. So as a reminder, the course evaluation is right here on the conference page. Remember to do your course evaluation so you earn your CEUs. And Jeff mentioned the directory that's available. So we've got a wonderful online directory that you should all check out. The next conference workshop will be next Thursday morning. And it's going to be the annual meeting. So make sure you attend that so you can vote appropriately. There will be some votes taken. So we want to make sure you all attend next Thursday's meeting, 9 o'clock. Thank you again, Hannah. Great job. And we look forward to working with you and hearing more about your future adventures. Goodbye, everyone. Have a great day.
Thank you, Tim. Thanks all. Thank you, Ron.